Hi, I'm Christy Manheim, and I'm the founder of Global Diabetes Care and Information. I just wanted to share with you some tips on testing your blood sugar. One of the first things that your healthcare provider is going to ask you to do is to keep regular track of what your blood sugar is, and if you are what you eat or your medication or any exercise that you do, how that affects it. So your healthcare provider is probably going to give you a free meter because most of the companies want you to use their meters, so they give it to you free. You have to pay attention to how expensive the refills are on the needles and the test strips, because that's where your money gets spent. So over time you may try different meters. There are many different kinds. Some are pretty small, some are big, some are so small they're like a USB drive, and but other ones you can plug into your computer and do graphs and all kinds of interesting information. So whatever works best for you is fine. They all do the same basic thing. They also come with, every one that you get comes in a little case where you can keep all your supplies, your test strips and your needles, and of course the monitor. It also comes with a lancet, and each one comes with a different kind of lancet. So if you try different kinds, you may find that you prefer one over another. They all do the same thing. They prick your finger, but some are easier to use than others. It all depends on your preference. And again, size may be an issue, depending on if you carry it in your purse or your pocket. So the needles are pretty easy to load. You just pull out the old needle and you put in a new one without poking your finger. And you see when you push the button, it releases, and that pokes your finger. Now, one tip after years of doing this, I can tell you, is make sure that you start on the lowest possible. They may have numbers or notches of some kind, and to tell you that this is not going to go very deep into your finger. So you want to start with the lowest setting, and then if it doesn't work, or if it doesn't prick your finger enough, then you can go a little bit higher, a little bit higher. Another tip, if you don't get enough blood on the first attempt, then you just may not have good enough circulation in your hands. It happens to us a lot when we have diabetes. So you can just shake your hands and get the circulation going, get the blood down into your fingers. Another tip is to always have everything set up and ready to go. So this meter gets to stay in its little case, so you don't have to fumble with taking it in and out all the time. You get a test strip ready, plug it into the meter. Most of the modern day meters, they automatically turn on when you put in your test strip, so you don't have to fiddle with all that. And you plug it in, see the lights come on. It's going to let me know it's ready. I have my pen ready, I have my log book ready, and my tissue. So it's ready for me to test. Now when you test your blood, you want to do different fingers. It doesn't matter which one you use, you just don't want to do the same place all the time because it gets a little bit tender. And if you type a lot, you don't want to use the very pad of your finger. Same reason. I usually brace my finger just so I don't pull away and have to do it 2 or 3 times. And just push the button, and see, that wasn't deep enough for me. So I just have to do a little bit deeper. Then you milk your finger to get a blood drop out. It doesn't have to be too big. And then the test strip will pretty much just suck that right up, like a straw. And it tells you it's done, and it'll register your blood in a few seconds. And here we go. 140. So I write down at 7 p.m. tonight after dinner. My blood glucose was 140. And then you just keep track, and every time you go to the doctor, You bring your meter and or your logbook so they can look at it and see what your averages are, and make sure that you're healthy and everything's working the way it should. Oh, a couple extra tips. One thing that the doctor mentioned was if your blood sugar goes low and you're out and about and you may have forgotten to bring glucose tablets or some kind of candy, if you, in your monitor, just keep change, so for the soda machine or the candy vending machine or something, and then that way you always have what you need. I think that's it.